So I had feeding tube surgery a week and a half ago, and I want to share the experience because it was bizarre. The prep for it was fine. I have had a lot of colonoscopies in my day. The prep for that is horrible. So the prep for this surgery was great. All I had to do was stop eating at midnight. So then I get there, they put me in the little waiting area. So the surgeon comes in to introduce himself. He walks in, he's like 17 years old. He looked so young. I think I'm maybe just at the age where everybody looks younger than I am. Like pilots all look younger than I am. I'm like, can you even read? And the whole time the surgeon was explaining what was gonna happen, I was like, they explained they were gonna put a tube into my stomach, and then they put a balloon on the inside of my stomach, so it won't just be able to be yanked out. I can't talk about this. Then the anesthesiologist came in, along with the nurse anesthetist, and I can't say those words again. So the first one was telling me, like, we're just gonna put you under twilight sedation, and we'll give you ketamine just to keep you calm because your breathing is bad. Like, we wouldn't want to knock you out fully, have to intubate you, and then, you know, not be able to take you off of intubation afterward. And I kept being like, but I'm a redhead, we need more. But I'm not even really paying attention because nurse anesthetist looked exactly like the guy from The Pit, who, spoiler alert if you haven't watched The Pit, is the one who steals drugs from his patients. So I was like, if I don't feel anything, I think we know who the culprit is. And once we get in the room, they put a ventilator on me. They put my head on a few pillows so I wasn't lying flat. And then they had like an imaging machine over my stomach. And then they started pumping me with twilight anesthesia and ketamine. I was like eloned out. I was like, so I don't actually remember anything from the surgery. I guess I wasn't like fully knocked out, but I think I was just having wild dreams. I do remember them like putting a tube up my nose and down my throat. I think the whole thing took like an hour total. I just remember then being wheeled out and back into a recovery room, and then the aftercare began. I'm gonna make a separate video for that because this story is gonna get too long. But yeah, I woke up with a new appendage.